It's kind of, in my opinion, it's honestly the most important thing. I think we saw a lot of that during COVID, where there was a lot of disconnect between what was real information, what was factual information, what was maybe opinion, whether it was professional or, maybe just someone that's on TV. It's slowly starting to improve in that standpoint. I'm noticing I'm having parents come in, actually, instead of the child coming in and asking for help, the parent is coming in and asking for help and actually talking about depression and anxiety, and not just saying like something's wrong with their head, or, they're not acting right, or all they want to do is sleep, and things like that. And I'm like, well, those are, some of those signs could be signs of something deeper. So
Hello, everyone. Welcome to the Career Education Learning Center podcast. I'm your host, Mitchell Rivers. I am thrilled and excited to have on our show today, Treston Clark Larue. Tristan is a physician assistant. Not only that, but Tristan is a graduate of the University of Pittsburgh and Campbell University. How are you doing today, Tristan?
I'm feeling good, Mitchell. Thank you so much for having me on. I'm glad, life was life in there for a little bit for us, but I'm glad we were able to make this happen.
Yeah, audience, behind the scenes, me and Tristan been trying to get together for a while now, but life has been life, as you said.
Yeah.
But we're here today. And I really like having a physician assistant here, someone who's involved in public health. And I told Tristan earlier, before we came on the show, is that I'm trying to lose weight. I'm trying to eat healthy. I'm trying to cut back on the sugar. And so maybe after this interview today, I'll be inspired to do so. Do you think we can do that, Tristan?
I'll try my best, man. But, we all can change a little bit. So, maybe it'll help me as well.
But Tristan, tell us, why did you go into public health? Is that something you want to be when you're small, or that's something you want to get into? Or why did you choose going to public health?
Yeah, so it was actually just an exposure, just an experience that I had when I was an undergrad. I got involved with some research at a hospital near campus. Like you said, I went to the University of Pittsburgh. So big medical university, big medical city. There's lots of opportunities, but I got lucky to join a research team that was doing some public health research. And when I initially started out, it was a work study. So, I was just trying to make a couple extra bucks for groceries and, maybe a book or two. But as I got into it, they actually gave me more opportunities to grow. They could tell that I was really interested in it. So I just tried to take advantage of it. From there, I actually was able to present some research alongside them. And during that research experience, I met actually other medical providers who were in public health. And they were like, hey, you're pretty young, but this is good work. Like, is this something that you want to do? And I said, well, I want to go to PA school and I don't know how it fits in. And they're like, no, we all have our master's in public health too. Like, we do both. And I was like, I've never even thought of that before. So from there, my number one priority was getting into PA school, but I also wanted to go back to school to get my master's in public health. And at the time, there's only a handful of schools that had both the degrees at the same time. So you can actually go to school and get both degrees in 3 years instead of going 2 and 2. Uh-huh. And so that's how I found Campbell. Because otherwise, I'm from Pennsylvania. I never heard of Campbell before. So when I was doing my research, I found a list of schools that had offered both degrees, and Campbell was one of them. And I was like, oh, I have a few family members down here. Like, let's go check it out. And I came down and I loved it, and they accepted me, and, the rest was history.
Well, that's fantastic, man. And I'm telling my audience now, sometimes you just have to look it up, right? You have to ask people, look things up, ask questions to professors or people who are your peers who are also in the same major that you are in. Or like I said, other people who are mentors or mentees, they can say, hey, maybe you can go this way. You never thought about it before. Was University of Pittsburgh your first choice for your undergrad, or were there other choices that you had?
Yeah, so I was probably like my junior year of high school. I was on the fence about whether I wanted to try to go play football in college or if I wanted to just go focus on school. If I was focused on school, I wanted to go to Pitt. I applied to some other places around Pennsylvania, like Penn State, IUP, Indiana, University of Pennsylvania, but Pitt, due to the medical presence around the city, I grew up in a small town, so I always wanted to live in a city. It just was like the perfect fit. And stepping on campus, it felt like I've been there my entire life. So when I kind of came to that crossroad, or whether or not I wanted to continue playing football or just going to school, Pitt's alone just sold me on it. Just going to focus on my education.
So your football career ended, huh, in high school, huh?
Yeah. I said, I think this is it for me. This is it for me.
Don't worry about Tristan. My football career also ended in high school. That was the height of my career. And I told Tristan earlier before we started the show is that my academic career ended in kindergarten. My height for my academic career was in kindergarten. Ladies and gentlemen, I was valedictorian. I had my afro like the Jacksons did on the cover Destiny. And that was the height. And from there, it went downhill.
Still.
It went downhill.
It still happened, though. It still happened.
It's still happening at my age. It's still happening. And so, did you do any research projects or internships while you was at Pittsburgh?
Yeah, so that was my primary research project. It was actually a team that was studying maternal drug use during pregnancy and why women were opting to, use illicit substances, and why they weren't maybe conveying that they were using or asking for help, or, all those little barriers that kind of pop up when people are struggling with illnesses like that. So it was, like I said, it started as a work study. I really didn't, in the moment, was like, oh, I'm about to turn this into a whole research project, get a couple mentors, like have this experience that's very unique to just me. I really just was trying to get into it, for the, just the money, the money, and just
when you're in college, ladies and gentlemen, a lot of you have been in college, hey, that money is short in supply. So if there's any way that you can get it through work study, part-time job, you go for it.
Yeah, absolutely. Absolutely. You just never know when you get those little opportunities. They might not seem like much, but if you just kind of put your head down and just kind of work, you never know what will come back to you,
Yeah. And so did that also include an internship? Because I try to tell my audience, especially those in high school, when they go to college, to talk about, getting an internship, because I didn't really have an internship. Tristan, my internship with Desert Storm 1991. And there wasn't much that I could do with my my MOS that I did in the war, because I was a clerk, and I went to school for banking and finance, or mainly business management. And so that's two type of different, let's say, dynamics, right? to go in. And so for you to be able to do that, it's fantastic. So when you went to Campbell University, did you have to do any type of projects or some type of fellowship there?
Yeah, so my first year, the way they split it up, because it is technically two different programs that you get done in 3. So my first year was all public health. I didn't do anything with the PA degree, no medical, nothing like that. We actually had like a project that we all have to do to kind of graduate the program, or the public health program. It's your capstone. What I did for mine, I had like a little internship at an FQHC called Commonwealth Health, and they had a HIV program there. So it's out in the country. So people who are, living with HIV could come there for treatment, resources, all those things. They'd help out with food, housing, anything you could possibly think of that's a barrier to care. So I got involved there, and what I realized was that there wasn't like a access all the resources for housing in the state or in the surrounding counties. It wasn't something that was like online or something they could hand out. And so I actually was like, hey, well, let's see if this is a need. Like, how many of these patients are actually, have unstable housing or unhoused, couch surfing, whatever the situation would be. And I found out it was actually a significant number. It was close to about 30 to 40%. And I would say it's probably even more than that. That's kind of a prideful thing. So a lot of people probably didn't want to admit to that. And so I took that. That ended up being my presentation, was that, hey, there actually is like a huge deficit, a need for stable housing in the HIV community. And then I was able to like collect a bunch of resources and made like a pamphlet that they had in clinic that they handed out to people that needed it. So that was like my research, my internship, fellowship experience there in public health. And then during PA school, there's not, you're really just going through rotations. There's not so much like a specific time period for a fellowship or internship. There's opportunities after you graduate, but that's within like your certain medical fields, whether that's like, certain type of surgery field or ER. There's different fellowships you can get into.
Yeah, that sounds fantastic. And I came up when HIV and AIDS came out in the 80s, big time, where there was a big fear. The same thing people may relate to the COVID fear. There's also a big fear with HIV and AIDS back in the day, and we just didn't know about it. And public health was trying to catch up with it, right? And there was a big time discrimination if someone had HIV and AIDS, to where, you didn't want to sit beside them, you wouldn't eat with whatever they ate, you wouldn't eat with them. Just a wild number of things going on there. And it's a time for public health to get us up to date into treating these people like treated, and they needed help. But sometimes they couldn't go to the hospital because nobody want to be around them. And so how much is the education in public health important to get that information out to the public?
I mean, it's kind of, in my opinion, it's honestly the most important thing. I think we saw a lot of that during COVID, where there was a lot of disconnect between what was real information, what was factual information, what was maybe opinion, whether it was professional or, maybe just someone that's on TV. And I think a lot of the distrust that kind of came from COVID and different, you talked about HIV, going back to even like syphilis and things like that. I think public health at its core is always about, fluid, transparent, thorough communication and making sure that you're reaching, everyone on the spectrum of their health literacy, not just the people that maybe, went to a 4-year, college and, are making $60K a year or whatever. Also the people that are maybe are living more check to check and maybe a little more unstable. You got to reach everybody with that communication. So it's very, very important in public health.
Yeah. Is it easier to get public health information out now via the internet? As far as now we have so many devices, so many platforms, you have Instagram, you have, Facebook, Instagram, YouTube, and etc. I mean, there's just so much information. Is that easy way? Makes it easier for you to get the information out to our people?
Yeah, I to some degree, yes. It might have been a little easier when it was just like the newspaper and the magazine. That's all you had. You read what you read, and like, the news was on at 6 or whatever. Because now you have like almost like too much information, right? You can go on your phone and look up information on anything. You could read both sides of it. So yes, it's easier to get information out, but it's also harder to get the right information out because you just don't know what the audience is going to consume when they're scrolling or looking on their laptops.
Yeah, and that's why you guys keep that information in check. I know a lot of people, including my family members, that first thing something happened to them or they get a diagnosis with a doctor, go straight to the internet. Like, don't go to the internet, doctor, because you said something symptoms, and I confess, Tristan, that when the COVID first came out, it seemed like when they would go over the symptoms that I had every symptom they had, right? And there can be a myriad of things, but a headache, this and that. But that's like 100,000.
Headache and a cough. Yeah, that's your allergies.
Oh my goodness, well, that's a lot of things, that really involve that. So I know that we sometimes can go overboard. One of the things I'm going to talk to you about is preventive medicine. How important is preventive medicine? So it from dentistry to health checkups to annual physicals. How important is preventive medicine?
Yeah, again, it's one of those, the cornerstone of public health, preventative medicine. Right now, I feel like, especially for the U.S. healthcare, we're very reactionary. We kind of reactive with everything. We wait until you have a heart attack to tell you to get on a statin or, whatever procedure you may need. We wait for these bad things to happen. And then all of a sudden it's like, you've already kind of dug yourself a hole. So preventative medicine, I mean, it just provides longevity, not only your physical health, but your mental health. And, it just kind of opens the door for, maybe more innovation, more spending towards, future medical treatments and surgeries and stuff like that. Instead of right now, we have we're spending a lot of money on these chronic illnesses that could have been prevented or could have been maybe not as severe as they are now. So hopefully, there's a lot more talk about focusing on preventative medicine. Hopefully in the next decade or two, we see a transition where, maybe you're getting some type of reimbursement from your insurance companies,
Yeah.
or things that just incentivize people to go see a doctor, go see a dentist, get your eyes checked. If you've got high cholesterol, start your statin medicine early. Things of that nature.
And I think from my standpoint is that for the last 2 or 3 years, especially during COVID, but in the last 2 or 3 years, there are some good news, and I hope this is an upward trend. Do you see an upward trend for more people exercising and trying to take care of themselves as far as eating and exercise is concerned?
Yeah, I definitely think so. And honestly, I think social media has a role in that as well. Now, it can have like a negative aspect because it can be harmful to your mental health, just kind of always comparing yourself to other people.
Yeah.
But being able to go on your phone and maybe find out, workouts if you have a knee injury and you can't go to Planet Fitness and start squatting and all that stuff, but maybe you can find a physical therapist on YouTube that can show you some workouts you could do from home. Maybe there's some call it fitness influencer or something that you're really inspired by. Maybe they have like a dietary plan that you can follow and things of that nature. So I do think there is an upward trend in it. And then, now we see a big push for the GLP-1s like Ozempic, Wegovy, and people are starting those medications. And, as long as you're used in the right manner, we're seeing people lose a lot of weight that they struggled with for a long time, seeing maybe old injuries and inflammation and everything like that start to resolve after they start those medicines. So I definitely think we'll see a bigger push to lifestyle changes and activity more so than we have over the last few decades.
Yeah, I kind of notice in neighborhoods where I see people running more, walking more, even walking their dogs more. So, any type of exercise is a good exercise, like 30 minutes walk.
Yep,
that's it. Or going the stairs, whether taking the elevators, I heard was good. How are we doing on the sugar front? I got to admit, and I heard this earlier, the hardest thing for me is to give up that sugar. Do you see a trend and us trying to be more aware of not eating as much sugar and processed foods as we used to when we were younger, especially people my age?
Yeah, I definitely see that trend now. We still, the teenagers, I'm lucky enough to work in pediatrics where I work. So I still got my teenagers coming in, eating their hot, Doritos and their, tequila.
Flaming Hots.
Yeah. Flaming hot Cheetos, all that stuff, and drinking, whatever they want to drink. But I have noticed like a lot of people, reference looking at labels a lot more than I remember before, when I was really starting out, talking about, I looked at the label and I saw how much cholesterol, I saw how much sugar and all those things. But, there's still a population that doesn't have the greatest access to the healthier choices. So I think it's going to be hard to have universal changes until, you expand or kind of open the door for those people to have access to better food choices. So you're still going to have people that are going to be eating a lot of processed foods and a lot of sugar and all those things until, that access is available.
Yeah, I think the thing about that is that if you're economically challenged, and we're going through economic times now, is that it's much more easier and feasible to get the high processed foods and to get the high sugars and whatever, because you can't afford for so much. And I don't know why healthy foods are so expensive. It wants to be healthy, but healthy food is so expensive. And that's another thing talking about preventive care, is that it's preventive care, from I heard from many public health officials, is way cheaper in the long run, especially if we come to wait till the last minute to have that surgery, that if you would have eaten correctly and exercise, and got your end of physical, whether it's dental or health-wise, then you wouldn't have to worry about it down the line to where you have to have major surgeries to correct things. Did you follow along with that?
Yeah, I agree with you completely. It's kind of like you have to invest early. You might have to put a little more money up front, but then in the long term, hopefully the spending from a healthcare government standpoint wouldn't be as much. But you got to be able to provide resources and time and energy for people to actually invest into their health to get the long-term benefit for sure. But right now, I feel like we're still very reactionary in a lot of things that we do.
Yeah, I think as Americans, from public policies across the board, we're always reactionary. Even everything, we are reactionary a lot of times, from sports to entertainment or whatever. We always reactionary to the hottest thing and the hottest trend, rather than, try to prevent that or make it better in the long run, right? Even talking about studies and preparing people for college or whatever degree they want to get it in, whether it's going to military or whether it's get a 2 degree, 4 degree, or apprenticeship or real estate license, something like that, is that you want to be pro that. If that's something they want to go into, let's learn it early, right? Let's make sure we get the basics learning early, and from pre-K starting all the way up. And then we don't have to try to chase them or try to catch up when we go, oh, now I want to go to college. Well, now, now we're trying to catch up your junior, senior year. When we said you're studying earlier, had a proper math and reading skills that you need in order to go to that next level. But we always playing reactionary, even from an educational standpoint.
Yeah.
Are there any projects you working on now? Are there any projects you're working on now as far as public health is concerned or trying to get us healthier?
Yeah. I have it's really just working on the framework right now. But in our clinic, we have a women's wellness clinic, which is for women who can no longer have children. They can come in for, getting a mammogram, pap smear, all that, get their cholesterol checked, and they can pay like a flat fee. And it's a great program. We usually have patients, at least a few times a week coming in to use the program, but we don't have one for men. There's not one for men. So right now I'm trying to lay down the framework, get the costs and everything figured out to see, could we have a similar clinic in our community for men and offer stuff like PSA testing for prostate cancer, still check cholesterol, and just give them someone that they can see and link them up for resources like with, they need a new primary care provider. If they maybe are interested in getting like a vasectomy or, maybe they have some urological problem that they're concerned about and I can help put a referral in for them. So that's something right now that I'm kind of working on. I was hoping to maybe get it rolling here, in the fall. You'll see the one thing about public health is things tend to move a little slow. So, so there's a few hurdles you got to jump over, but I'm very, passionate about men's health, not just from like a treatment standpoint, but just from like, having conversations like this, and just spreading awareness, because as the large majority of men are, they are the worst for being reactionary.
Oh yeah, we the worst. There's no doubt about it. I mean, y'all, Tristan trying to be nice about it. We are the worst. You know that. We know your uncles, your grandfathers, especially if you got uncles and grandfathers. Anybody 50 and over, oh, they the worst because they grew up with their parents, especially their father and grandfather. They never want to go to the doctor. Oh, it'll heal itself. But grandpa, you're bleeding. Your leg is crooked. It'll heal itself. I just put some ice on it. I think you need to go to the doctor, Grandpa.
Yeah, exactly. Yeah. Or, my heart, every time I stand up, my heart's hurting. Like, no, it's just heartburn. It's just heartburn. It's all this heartburn. So, that's something that I'm passionate about. It's just maybe, getting towards the younger generation and making it more of a focus, of not just like, lift weights and, it's also about eating healthy and taking care of your mental health and getting your blood work and all those things. So, it's a little project I'm trying to put together right now where I work.
And before we leave, I cannot let you go without talking about mental health. Last month in May was Mental Health Awareness Month. And how important is mental health as far as with the public policy? Because I think now we're starting to realize it, especially the African-American community. I think about 20, 30 years ago, it was a stigma on mental health as far as getting help with therapy and getting help with your mental health there. How much does mental health plays a part in public policy these days as far as trying to get ourselves not only physically, but also mentally prepared for life?
Yeah. Well, I think it's a really important part of it. And I think we're still trying to figure out how we, in that sense, be preventative about that, or at least attack it early before, larger problems develop. There's still room to grow in terms of expanding access to mental health services, incentivizing, nurses, therapists, physicians, PAs, NPs, whoever, all shapes and sizes of medical professionals, to incentivize them to get into mental health. Because a lot of places across the country don't have enough mental health providers. So even if, you are struggling and you ask for a referral somewhere, it could be, 6 months to a year. And even then you miss one appointment, who knows the next time you can get back in. Right. So we're making steps towards, improving mental health access and everything from a policy standpoint, but there's still a big gap. There's still a big need, but I have noticed that, even just in my few years of practicing, a transition from, especially with, families who are maybe Hispanic or, Black, or basically, ones that traditionally are kind of don't really vibe with mental health illnesses. I have noticed
communities, right? Mm-hmm.
Yeah, it's a big stigma in certain communities, and so I've noticed that it's slowly starting to improve in that standpoint. I'm having parents come in, actually, instead of the child coming in and asking for help. The parent is coming in and asking for help and actually talking about depression and anxiety, and not just saying like something's wrong with their head, or they're not acting right, or all they want to do is sleep, and things like that. And I'm like, well, those are some of those signs could be signs of something deeper. So it's a matter of time, I think, until it all comes together. But yeah, we're definitely making some big steps to improving mental health for the country.
Well, I tell you what, this has been a wonderful show, and I really wanted Tristan to come on here to address public health and mental health, physical, as far as keeping yourself to whole. That's mental, spiritual, that's everything together here. And Tristan, I really appreciate you coming on the show. But before we leave, do you have any suggestion of advice for young people who may want to go into public health and what they can do about that?
Yeah, the biggest thing is just putting yourself out there, taking some risks, and networking. The reason I got my job, the reason I have the opportunities that I have, is from people being able to state the type of worker that I am, state the type of person that I am from a personal standpoint, not just from them giving me a paycheck. They know the type of person I am. And then I've made a lot of good connections, like on LinkedIn and through school, and through just, hey, I know this person, let me give you their number, that kind of thing. It's important, especially in public health, because it's hard to get certain jobs, and there's not a lot of jobs. So you really have to build those relationships and get yourself out there, versus just kind of, I hate to say hiding, but, sitting behind a computer and just hitting send on resumes all day. That might not get you to where you want to get to. So you really got to put yourself out there, but there's the possibilities are endless.
Well, I tell you what, man, this has been a wonderful podcast. You give a lot of information there. And Tristan, maybe the next time I talk to you, next 2 or 3 months, I'll be down in my weight and I'll be healthier and younger.
Hey, I love it, man. Maybe me too. Maybe we can talk about our progress in a little bit.
Yes, sir. Well, thank you so much for coming on the show today, Tristan. I really did appreciate it.
Yes, Mitchell, I appreciate it. And thank you for all the work. I told you before, I was able to check out some of your videos before. It's great. And hopefully some people are able to take in all that information and just grow from it.
Oh, thank you for your kind words. And I'd like to thank our viewers and listeners for joining me on another terrific episode on the Career Education Understanding Podcast, where we're making your career dreams a reality. God bless.